when the CT scan contradicted the smile. As an ER nurse, I'll never forget the night a cheerful 26-year-old named Samantha walked in. She looked completely normal, wearing yoga pants and a college sweatshirt, and was laughing about her visit. She claimed she had just a little gas and joked that her boyfriend dared her to come in because she wouldn't stop burping. Her vitals were only slightly elevated. I almost marked her as non-urgent. Drop of blood, the wince that saved a life. But something tiny caught my attention. When she got off the gurney to use the bathroom, she winced for just a fraction of a second, a tiny movement she immediately masked by joking around again. That subtle sign was enough for me to convince the doctor to order labs and a CT scan. Samantha thought it was hilarious, taking selfies and texting her boyfriend about the expensive emergency room gas. The labs came back showing a high white count and elevated lactate, but Samantha was still scrolling through TikTok videos. Then the CT results appeared on my screen. I had to read the report 3 times because it defied what I was seeing in the room: massive mesenteric thrombosis. Kitchen knife the dying bowel. A blood clot had completely blocked the arteries feeding half of her small intestine. According to the imaging, she was in early ischemia. Her bowel was literally dying inside her body, yet she was oblivious. The ER doctor was stunned. This condition usually causes patients to be screaming in agony and vomiting. Samantha was sitting up, asking if she could order pizza. We had to move immediately. As the doctor explained she needed emergency surgery, reality hit. Her smile vanished. She began crying, not from pain but from fear. She confessed that she hadn't talked to her mother in over a year after a stupid fight and was terrified of dying without making amends. While the surgical team prepped the OR, I helped her dial her mom. Her mom didn't answer, so I left a voicemail. I explained Samantha was having emergency surgery and wanted her to know she loved her. Samantha squeezed my hand until it hurt. The surgeon later confirmed that if we had waited even 2 more hours, she would have died. They had to remove 3 feet of dead intestine. The voicemail aftermath. Samantha spent 2 weeks in the ICU. I checked on her every shift until she was stable. She went home missing part of her small intestine and facing months of recovery, and she never joked about stomach pain again. 3 weeks after she was discharged, her mother walked into the ER, not as a patient, but to find me. She had driven 4 hours to thank me for that voicemail. She said she had listened to it 20 times and cried every time. She and Samantha were talking again, slowly rebuilding their relationship.